Well, I think we'll wait. I only see 12 in the room at the moment, which is us. So 49, that's good.
Good morning, Keith.
Good morning, everyone. Good morning, everyone. And
Good
really,
morning,
thank you
everyone.
very much
Good morning.
for joining us.
Keith.
Good morning, Keith.
Good
Good
morning.
morning.
Good morning.
Good morning.
That's
Good
great.
morning.
Good morning.
Good morning, everyone. And I'd like to thank all who contributed to make this possible, that we can reach out and join you wherever you are. We really have been concerned to overcome the isolation that we're in. Maybe sometimes we overdo it in trying to organize meetings to ensure people are together. But I'd like to thank Felix, Cecilia, and everyone who made this possible. What we wanted to focus on today, really, and share with you is not so much about what we're doing as EuFMD, but more how we have been adapting our work before and then during this COVID crisis. So firstly, regarding who we are, EuFMD is an FAO commission. It's a European commission, so the EU stands for European. It doesn't stand for European Union, because we have 12 members who are outside of the EU. So we're completely paid for by our member states and by the projects which are funded by donors, working within the legal context of FAO. The screen in front of you is just to say that we have to provide services to these countries in green to help them prepare for FMD and other risks. And we also work with countries which have foot and mouth disease within our membership, such as Turkey, Georgia, Israel. So we even have to coordinate some of the actions within. But we also interface with neighboring regions, and there we need to work very closely with FAO and OIE in terms of coordination to those regions. And because our risk comes really from anywhere, then and that's been our experience, then to reduce that risk, we need to also promote global control. So we work with an additional 40 countries, but at a distance. So a lot of our work is already at a distance. And go on to the next slide. Then I'll just give you the structure. Next slide, please. That's it. So really, we wanted to talk about with you about what we're already doing in the lockdown to help countries prepare at national and regional level. Can we work better with neighborhood countries, even without missions? And then on the fourth topic is, can we help our partners to deliver more through virtual learning centers and other distance approaches? And then, certainly not least, can we be socially together rather than socially distant, and be at the same time physically healthy and mentally healthy? And then finally, what do we do about global meetings that we had planned? So if we go on to the next slide, should come on. Firstly, foot and mouth disease might be not in the main sphere of what you think about, but there's actually many similarities between the problems of foot and mouth disease and COVID-19. And both are exceptionally infectious, and they're an extreme challenge for veterinary services, medical services to control where there are naive populations. And so the fear is with both that they overwhelm attempts at containment. So with foot and mouth disease, to the idea of a lockdown that is regional level, national level, holding level controls on movement. This can only be done with a high level of public support and planning for businesses to survive, which we also see with COVID. And you need the highest level of political support. Otherwise, the veterinary services cannot function to do those things which are not very popular. And you have to think about the exit strategies, which can be long before business returns to normal. So for that reason, modeling, and we'll hear a bit more about that, is something demanded by our member states. differences are probably very apparent, but we've had about 100 years to understand foot and mouth disease transmission, only 2 months with COVID, and that aerosol spread with foot and mouth is actually already proven to take place over longer distances, and that's an issue. The human-mediated spread, people are involved in spreading FMD and fomites, but we haven't seen that yet with COVID and domestic pets. So, and probably the last point before Eleanor transitions is that well-structured exit strategies on how we move from lockdowns do exist for FMD, but they have to be worked out, of course, for COVID. Next slide. Fabrizio.
Yes, the general session last year in April, our 39 member states indicated and requested to make the best use of the tools and experience that were developed by EuFMD along the previous years, with the objective to improve a cost-efficient means to monitor risk, to provide early warning and improve preparedness for other transboundary animal diseases considered at risk for member states. And with the tools and experience, I'm referring in particular to the training platform, to the spread models, simulation exercise, and all the tools developed for improving emergency preparedness, the applied research program, and the regular risk reporting for FMD through the global intelligence. So following that request, the old FAST strategy, so for FMD and similar transboundary animal diseases, has been developed and planned to be delivered with the current work plan, which keep the focus on FMD risk reduction, but extend also the scope of the preparedness and risk reduction other activities to other similar transboundary animal diseases, which pose an immediate threat for the members. Next slide, please. So the current work program is organized in three group of actions, so 3 pillars. The pillar 1 is to aim to improve the preparedness for crisis management by our 39 members. The pillar 2 is focused to reduce the risk to members from the European neighborhood, so to improve control of FMD and improve surveillance for other transboundary animal diseases. And the pillar 3 is to sustain and support the GFTAD global strategy against FMD. Next slide, please. Over to you, Keith.
Thank you, Fabrizio. This is a slide just to illustrate that over the last 4 years, we've had already an extensive program of trying to deliver online training. This is not simply like an open access website, but these are delivered courses, delivered through a blend of expert trainers plus online e-learning. So I think there's in the region of 70,000 hours of training has been taken by trainees, and that's in the member states, but also nearly 50,000 hours of training has been taken up. That's the recorded amount of time spent on those trainings by trainees in the pillars 2 and 3, that is the regions of the European neighborhood and also in the global region. Next slide. So we have, let's say, this is just to remind us of the joy of being back in headquarters. Imagine what it's going to be like. That's the slide. Next one. Next slide, thanks. Okay, we have quite a significant number of people, and they're not all in FAO headquarters. So we already work, as I'm sure many of you do, with people who essentially telework from a home location in support of our program. So maybe these things have helped us a bit when it comes to transitioning. So I'll now hand over to Maria for the next slide and the next part.
Thank you, Keith. Sorry, a minute that okay. That's better now. So as Fabrizio was saying before, the pillar 1 of our working program is about emergency preparedness, and I'm going to present some of the tools that we have that are particularly useful in these times of lockdown. So next slide, please. Okay, the first of the tools we use, and it has already been mentioned, is online courses. So I'm not going to go into great detail, but just to say that we have multi-country and country-specific courses that we try to tailor to the needs of every country, and that we have been delivering courses in different languages, like English, Spanish, French, but even more exotic languages as Estonian, Polish, or Serbo-Croatian. So online training gives the advantage of using translators, and it facilitates this kind of training in the languages of their own countries. And we also have, as most of our courses are, as you said, tutored, but we also have some courses that are open access courses, and we are trying to give more visibility to these ones, that they could be very useful in these times where people need to stay at home, and especially also even for students in university. So next slide, please. Okay. Then to improve preparedness, we also try to support countries through simulation exercises, again, multi-country or national ones. But what happens now that we cannot travel? So next slide, please. In this case, what we are trying to do is we are trying to develop a concept to organize simulation exercises online, even considering that not only us are under lockdown, but even other countries. And to do this, we are going to use a software that helps to create the scenarios and to manage injects, very useful to use remotely. And well, you can see pictures of 2 of the people involved on this, but of course, in every one of our activities, there are many people involved. And we have already made a proposal to our members on this, and at the moment, it seems that it has been quite well received. Next slide, please. Another one of our tools is called Get Prepared, and this is a tool that we are developing, and again, doesn't require any face-to-face interaction with countries. So basically, Get Prepared is a toolbox that will allow countries to assess their level of preparedness and to have access to resources and good practices for emergency preparedness. So we think that there are so much experience out there, but sometimes it's not easy to find all these good examples that we can each one of us learn from. So we are trying to put that together in an organized way that helps countries to progress in their preparedness against fast diseases. So Get Prepared is a wall, and in this wall, every brick is a component in emergency preparedness.
Hi, Maria. Sorry to interrupt you. It would be interesting. Yeah, it would be interesting to show the wall to our audience. Would you do, please?
Yeah, sure. Yeah, I'm going to share my screen, and I'm going to show you the wall, because even if it's under construction, we already have something to show that probably will help to imagine this. So can you see my screen now, Shankar?
Yes.
Okay, so this is our wall. This is Get Prepared. You can see it has different layers because we have tried to align it with the GEMT. And you can see in emergency preparedness, if we go to the bottom, we have the foundations, we have an alert phase, we have an emergency phase, and we have a reconstruction phase. So back to the foundations, I'm going to show you how it works the wall, because basically if I click one brick, one component of emergency preparedness, in this case simulation exercises, I see that the brick is opening into an assessment part and a resources part. So if I click on assessment, I will gain access to a self-assessment questionnaire. So a country can evaluate how well prepared they are to use simulation exercises as a way to test their contingency plans. So back to the presentation, please. I'm going to show you another tool that we have that is, next please, is a modeling tool. So EuFMD is the European Foot and Mouth Disease Spread Model. So it's a very flexible tool that helps countries to support FMD planning, training and response. And for the moment, we have already 10 countries that are part of the model, as you can see on the screen, but we aim at making it much bigger, and as we believe it's a very useful tool. But for this, maybe Shankar, I'm going to pass it over to you, because I'm sure that the best way to discuss about this is being able to see how the model looks like.
Thank you, Maria. And I'm going to demonstrate how EuFMD model works. So are you seeing my screen now?
Yes, that's perfect, Shankar.
Okay, great. So before going to demonstrate this model, I would like to emphasize on the use of this model. So our member state or the participating countries can use this model for various purposes. For example, they could use this model to estimate or predict the magnitude of a potential epidemic. Also, they can assess their existing control measures, and they can use those outcomes or the model outcomes to amend or update their control measures, control plans. Most importantly, the member state can use this model to estimate the resource requirement for an epidemic based on their scenarios. For example, they could prepare for the worst case scenario versus a best case FMD outbreak scenarios. Now I'm going to demonstrate you this model. So this is the interface of our model. And behind the scene, we have a lot of data. You can see in this list, we have a lot of data. All those data are uploaded in a CSV file. This interface also allows us to make changes. We don't need to go behind the scene to amend the data to make changes. We can do from this interface. So for example, if we want to make some changes in vaccination strategy or vaccination parameters, we just click here and we can make those changes instantly. Also, we can use this dialog box to make the changes in the depopulation strategy. For example, stamping out of infected herds versus ring culling. In the same manner, we can also use this dialog box to make the changes in the resources. So for example, this dialog box has a lot of resource requirement. During the outbreak control, you may know that we need a lot of team resources for different activities. For example, surveillance, culling, disposal. So we need separate teams for those all activities, and we can make changes, those team numbers here, and we can see how those can impact on the epidemic duration and epidemic size and other epidemic outcomes. Basically, this model requires 3 different types of data. Population data, disease spread data, and this is the population file we have in this model. So we require population data, disease spread data, and control measures data. So now I'm going to show you how this model works. So I'm going to start the outbreak from this particular location. If you see, that is in orange color. And you can see how the disease spread from this location to other susceptible farms.
That's really interesting, Shankar. Thank you very much for this presentation. So we can
just a moment, Maria. So all the red arrow represents the direct contact, and if you see some, there may be some yellow arrows that represent the transmission due to indirect contact. The green zones you see in between, those are local area spread, and their third mechanism of third transmission pathway is airborne transmission, which is not very frequent mode of transmission, but you can see at some point there is some airborne transmission. And thank you, Maria, and over to you.
Thank you, Shankar. I'm sure we could stay much longer showing this because it's really nice. But this disease spread model is very good to show how the disease could spread in Europe in this case. But of course, we need to understand also the risks that could affect Europe, the risks of transboundary animal diseases. And for this, I think the expert to let us know what EuFMD is doing is Fabrizio. So Fabrizio, over to you. Thank you very much.
Thank you, Maria. Yes, the activities implemented in Pillar 2 are aimed to reduce the fast disease risk to EuFMD members from the European neighborhood. And the countries that we are targeting for this particular activity are the countries that you see on the screen in green. Next slide, please. Yeah, the activities are grouped in three main components. So there are activities to facilitate the coordination with our GFSAT partners and to provide assistance for improved surveillance and control for FMD as a focus, but also in particular surveillance for other transboundary animal diseases in the neighborhood. There is a group of activities focused more on the identification of risk hotspots and assist the implementation of integrated risk-based surveillance in such risk location. And then a group of activities which are aimed to support what I have just described, and they are more focused on the capacity development, so capacity building. We did, and in particular, we have defined training skills that goes for different subjects. You have on the screen the two examples on risk mapping and surveillance, but we have others for PPP, for the socioeconomic, for the post-vaccination monitoring, for the laboratory support. That all goes from the e-learning for a wider audience to face-to-face training, to then field activities or in-country activities. So what we call an applied learning. Next slide, please. And all the informations that are generated together by these activities, and together with the system that is already in place for FMD, and in particular related to global intelligence, will assist and contribute to improve the collection and analysis of risk information for the EuFMD members, 39 countries, for a better risk assessment and forecasting. Next slide, please. So that was more a summary of the activities, and here we have more the focus of this meeting. So in the current situation, we had to make the best use. We have to make the best use of the tools that we have available, and in order to try to deliver the work plan with considering the travel limitations and restrictions that we all have. So we had two questions. So how to adapt our work considering the current situation, but also how to make the best use of the opportunities that this situation can bring. For example, experimenting less travel and more backstop support to countries, in order to have that more availability of more resources available for field studies and applied training activities. And I would like to mention in particular two examples that were recently implemented. One is a survey that we carried out using our e-learning community to better understand and forecast situation and needs, with particular reference to bovine ephemeral fever. So it was more to identify a potential mechanism for finding what are the informations and what are the perceptions from field veterinarians, so public and private, on the presence of the disease and the risk factors in the field, considering that the disease is not listed in the is not part of the OIE listed diseases. And the other example is referred to the virtual workshop that we are currently implementing with the Middle East countries. So I would like to invite Etienne Chavan to introduce and explain the first example. Etienne, are you there?
Yes, good morning, Fabrizio.
Thank you, Etienne. I would like the question that I have for you, if you can explain what are the objectives and how the survey was implemented, as I was saying, trying to make the best use of the EuFMD audience.
Okay, thank you very much. I'll try to answer this. Maybe we can move on to the next slide. Next, yeah, thank you very much. So, as it has been already mentioned many times in this presentation, the EuFMD has an extensive experience in developing and delivering e-learning courses. Over the past 6 years, we have trained on our platform more than 10,000 colleagues worldwide. And we believe that the e-learning trainee community we have built and maintained represents a unique network of, or body of, informants. Bovine ephemeral fever is a vector-borne disease of cattle and buffaloes and caused by a virus which is called bovine ephemeral fever virus. As you said, Fabrizio, it's not an OIE notifiable disease, and it is probably the most under-documented disease among the fast ones. So our knowledge on BEF heavily relies on scientific publications, which are scarce, despite the increasingly frequent occurrence of BEF infections in the European Union neighborhood, some of which associated with high fatality rates. So on the one hand, we have this unique EuFMD trainee community, and on the other hand, we have an under-documented fast diseases. So why not conducted a web-based survey among this particular community to address the following objectives? So gain better understanding of the BF situation, surveillance and control in the countries of West and North Africa, the Middle East, West Asia, between 2015 and 2019, but also to explore BF awareness and training opportunities for veterinarians in the European Union neighborhood. Next slide, please. So in practice, the methodology was quite cost effective because from questionnaire design to result communication, it took us 4 months. Very briefly, the web-based survey was designed on SurveyMonkey, and the questionnaire was reviewed by BEF international expert based in Qumran Veterinary Institute in Israel. The questionnaire included 35 questions divided into 7 sections. First, respondent socio-demographic, BEF occurrence in the EU neighborhood during the study period, BEF diagnosis capacities, BEF surveillance, either passive, active, or vector surveillance as well, BF vaccine availability and vaccination, legislation applicable to BF control, and finally, knowledge, self-assessment, and perception of bovine ephemeral fever, and interest in training. The survey was distributed to all the contacts we have from the 21 countries, and the participation to the survey was voluntary. Data analysis has been carried out between February and March, and as I said, results will be communicated to all the contact of our trainee community by the end of this month. It's worth noting that the results that we get from this study cannot be considered as official data from the country or institutes from which the respondents are.
And Etienne, can you briefly indicate what are the most important or significant preliminary results, or just to give us a flavor of what can be obtained by such survey among the trainee community?
Yeah, sure. Next slide, please. So, as you said, we are still in the preliminary phase of data analysis, but what we can say very briefly is that within 1 month, we obtained 270 responses. In the pie chart in the slide, you can notice that participants to the survey were official veterinarians mostly, but it's worth noting that laboratory veterinarians and private veterinarians also took the survey. So this broad spectrum of respondents' profiles reflects the variety of position we have in our database. Overall, in the graph below, you can see that 40% of respondents reported previous experience with bovine ephemeral fever, either through outbreak investigations, sample testing, outbreak management operations, risk assessment, or attendance to training workshops. Next slide, please.
And Etienne, if you can be a little bit brief, because we are running out of time.
Yeah, I'm sorry. So in this slide, you'll find just the preliminary results regarding BEF reported occurrence. On the map, in red, the 12 countries out of the 21 in the survey who reported occurrence of BEF infection at least 1 year during the study period, and in dark red, the provinces that were specifically affected by bovine ephemeral fever. In the graph on the right-hand side, you can see that respondents reported the likely months of BEF infection and those results are shown by region. So, for example, the line in blue shows the seasonal trends of BEF infection in the Southeast European neighborhood. Of course, those results are very preliminary and are currently under review by virologists and entomologists working on bovine ephemeral fever. Next slide, please.
Etienne, you have
Please,
1 minute.
Fabrizio.
Yes.
Okay, so very briefly, the results to this survey assisting us in mapping the laboratory capacities, as you can see on the table on the left, but also in the last section of the questionnaire, we asked the participant to assess their knowledge on BEF, and overall, the knowledge either on BEF epidemiology, diagnosis, and control was reported as poor, and this evaluation, this assessment was consistent across the 4 countries. So we have here good material to assess the training needs of our EuFMD community.
And if you have to select one among the most important conclusions that you have, which one would you select? Which one would you highlight?
Thank you. Next slide, please. We'll try to be very, very quick. Okay, so just saying that this this survey gives a very preliminary insight into the BEF recent situation, surveillance and control measures in place. What we can say is that the results pledge for improved awareness and training on BEF for veterinarians, both at the central and subcentral levels, and that the reported occurrence of BEF is quite important in the EU neighborhood. And just to answer to your question very quickly, the very big advantage of this survey is that it helped us through the survey of our community to identify key areas to be addressed in the near future, improving the information sharing on BEF presence, but also to better understand the bovine ephemeral fever transmission dynamics, seasonality in the different regions, what are the mechanisms for long distance spread, and also identify or support research towards the identification of BEF competent vectors. So we have this survey, although very simple in its methodology, bring us some interesting insight into research and new action from the EuFMD.
Thank you very much, Etienne. Thank you very much, Etienne. The other activity that is currently ongoing is related to the virtual workshop Shaheen is organizing. Shaheen, if you can explain what was the original plan of this workshop and how the workshop was transformed.
Okay.
We have 3 minutes.
Okay, thank you, Fabrizio. The face-to-face workshop originally was proposed to be held in Jordan, in Amman, on the 24th of March. The main aim of this workshop was to improve the surveillance for fast disease in the high-risk areas in the Middle East countries. Through identification of methodology, prioritization of areas and activities, and involvement of the stakeholders, and also to identify common regional priorities within the epidemiology and laboratory networks, and to identify a mechanism to facilitate the regular mutual exchange of expertise and experience. We have 7 countries from the region. Mainly we have 4 countries from Remeza network: Egypt, Lebanon, Jordan, and Libya. And we invited also Syria, Sudan, and Palestine as observers. We had 1 representative from FAO sub-regional office, 1 representative from OIE sub-regional office, and we already invited 2 participants from the Arab Agriculture Organization for Agriculture.
Can you explain how the workshop is organized now?
Okay, next slide, please. Next slide. Please, next slide. Once the face-to-face workshop has been postponed, we decided to transform it into a virtual workshop, and we tried to focus more on the surveillance. And we shortened the list of the objectives to be to improve skills for designing integrated surveillance for fast disease and early detections and case finding in high-risk areas, and also to scrutinize the support that epidemiology and laboratory networks and different training scheme can provide to improve skills for surveillance design, and to define risk-based surveillance for multiple disease, which is very important in these countries. As you know, the resources is very limited, and this if they can define the risk-based surveillance for the multiple disease, they can implement it according to the priorities and objectives.
Yeah. Shaheen, can you explain how the workshop is organized? Sorry, because we really don't have a lot of time.
Okay, next slide, please. First of all, we dedicated an area through the EuFMD e-learning platform, And every week we provide the participants with recorded videos, supportive materials, and links and assignments relevant to the topics that already covered during the week. And the participants have the opportunity to discuss and consult the trainers through the online forum. Next, please. Every week, the participants per each country we invite them to online meeting separately per each country to discuss the feedback on the assignments, and the trainers and facilitators involved in these country meetings. By the end of this workshop, there is a closing meeting. We will conclude the activities and we'll summarize the expected outcomes. And we invite the countries to nominate one participant per each country to give a short presentation on fast surveillance and final assignment. Next, please.
And what are the main challenges that you see?
The main challenge that I can see, I would say that time was very limited, and we had very quickly to move from physical meeting to distance event, and we needed a big support from the operational team for recording video, organizing these online meetings. As you know, we have 7 countries. That means we have 21 online meetings during this workshop. In addition to the opening and closing, and also I think it was very difficult to adapt 3 days work and see what were the conditions in the different countries, considering that they are already in lockdown situation, and that's why we decided to cover these topics in 3 weeks' time.
Thank you very much, Sain, and sorry for speeding a bit up the presentation. And I think that this is really an innovation way of adapting our activity that might be useful, not only for the neighborhood, but also for other regions that are probably even more distant to Europe and to the EuFMD member states. And I take the opportunity now to give the floor to Paolo.
Yes, thank you, Fabrizio. Please, could you move to the next slide, please? Thank you. So, well, I'm going very quickly, repeating what has already been mentioned before about Pillar 3 and the strategic objective for the sustainment of the progress of the GFTAD's global strategy for the control of FMD. So this is currently assisting about 80 countries globally in Asia and Africa, excluding Northern Africa that has been described already by Fabrizio. We have a number of initiatives and activities that are included in our work plan for Pillar 3, but today the discussion is about new ways that we can use and promote to support the progressive control of FMD, adapting to the current challenges and restrictions. So if we can move to the next slide, I think we can focus more on how we can further develop virtual environments for improving assistance at the country level, as well as at the regional level, to build capacities, as well as to assist countries in progressing strategically along the FMD PCP. And here we will mention specifically some activities through what we call virtual learning centers. And then other mechanisms that are allowing us to work and facilitate work online and remotely are tools that have been developed specifically for supporting the development and implementation of an evaluation of strategic national plans, as well as assisting the GFTAD partners in the management of these strategic plans. Next slide, please. So this has been mentioned already before. EuFMD has broad experience in e-learning and virtual training. Briefly, I think there's available training in about more than 40 languages at the moment, and we have a training menu of, for countries that are engaged specifically in FMD PCP from stages 0 to 3, which offers a blend of open courses and in-depth tutored courses. And there's also a blend of training resources and e-learning resources that are always always ongoing, available online. These training are always developed based on training needs assessment that are conducted, but sometimes we also develop training to respond to specific requests or gaps that have been highlighted to us by our partners and GFTAD partners. Currently, we have an ongoing online training on vaccination and post-vaccination monitoring, which is running on his 4th week at the moment. Will be running for the next 2 weeks. We have about 250 participants in this course from more than 20 countries, 40 countries, and there will be other 2 trainings starting in the next 3 months. Next slide, please. So recently we started expanding these virtual environments to strengthen the support that we are providing to regional partners and directly to individual countries. And this is how we managed to come and develop in collaboration with regional and sub-regional FAO offices, virtual learning centers. These are virtual environment to try to improve the tailoring of training for improving national competencies and skills that are required to progress through the PCP, to the FMD PCP, as well as this platform are also intended to provide a resilient and cost-effective environment to strengthen the collaboration between technical networks at the regional level through offering of opportunities for organizing virtual workshops, virtual meetings, and webinars. But also they provided the opportunity to increase the traceability of the training activities that are conducted at the national and regional level. So they will be also helpful in improving or developing systems for continuous professional development of animal health professionals. Next slide, please. So the first VLC collaboration that we established is in collaboration with the sub-regional office for Southern Africa in Harare. So everything originated, let's say, some time ago when we ran the first e-learning targeting Southern African countries, where we observed a very high interest, and it was greatly successful. And since then, so this was happening in 2016. Since then, conversations and discussions were ongoing with our colleagues in Harare, and we were able to collaborate together with Vedane in order to establish this VLC that is currently based and working full-time in Harare. So if Berano, you are online, perhaps you could help us understand a bit more the details about the background and how the idea of this VLC came to life.
Thank you, Paolo, very much. Greetings to you all from Harare, which also joined the coronavirus infected countries, and we are working from home, teleworking. As Paolo was saying, looking into the benefits of e-learning and virtual workshop arranging meetings, the Southern African Livestock Technical Committee, these are directors of veterinary services in the 16 member states of SADC, requested us as FAO the establishment of a virtual learning center which caters to their different needs. As you know, Southern Africa is one of the sub-regions in Africa which enjoys a lucrative market for their beef, and recently, in addition to the 4 countries, Namibia in particular managed to access the American beef market. So this is a valuable resource to protect, and through training, they can enhance more compliance with international markets. What we have done was preparing a project proposal on the establishment of the Virtual Learning Center for Southern Africa in collaboration with the EuFMD. And the proposal was accepted by AGA kindly, and the activities of this center for Southern Africa is kindly supported and financed by EuFMD. I would like to take this opportunity to thank EuFMD for their valuable support for a period of 1 year, after which we'll try as much as possible to mobilize resources and make sustainable. This is really one of the very important centers which enables us achieve, especially during this lockdown time, deliver a lot. Over to you, Paolo.
Thank you, Verano. If we can move to the next slide, perhaps we can briefly see some of the advantages, let's say, that and the opportunities that a virtual learning center can offer in terms of delivery of services at the regional and national level. Obviously, it enables to reach a greater audience for lower costs. It is actually a real on-the-job training, because obviously this can be conducted while you are in your office, or anyway, you don't have to travel. The resources are easily translatable or scalable, and they can be available online all the time. There is a possibility to have a traceability system that enables to build up records of learning programs. And there's also, as we mentioned before, this platform offers a fantastic opportunity to bring people together, not only for training purposes, but also to organize project meetings rather than virtual workshops, rather than webinars and other learning activities. If we can move to the next slide.
Paolo, can I suggest that maybe we just for time, because I want to sort of close this by within the hour, maybe we could move on to Marcello. I know you had some other things you wanted to cover, which were related to support, but maybe in the questions and answers. Could we move on? We've got Marcello, and then we close.
Yeah, sure.
Okay, there we are.
Yeah, thanks a lot. Sorry, Paolo, for jumping in. And in very brief, my colleagues earlier explained some of the creative solutions that we are offering in terms of our external training, in terms of our external events, for example, but we are looking also inward, and we found that as an opportunity. We try to use that word of teleworking for people learning some new tasks, and that is partially linked with what, for example, Shane Fabrizio said earlier. Some of our colleagues are learning how to support our learning platform, but there is also something else. So next slide, for example, we faced some issues that you are well aware of, communication, a higher sense of feeling disconnected, of the risk of being disconnected from work, not stopping enough time. So we have found this creative solution in addition to FAO suggestions to define some free slots on a daily basis where not to organize any meeting. And in the next slide, I want to show you some of the creative solutions. There's a quite very huge list of some of the solutions that we found to enhance our team spirit. From really day one of the lockdown, we look forward to create some WhatsApp groups and to enhance the team experience with some rotating coordinators offering daily challenges. Our today's challenge is to provide some, to do some very small actions in terms of environmental health. And congrats for my colleagues doing, preparing those challenges. We are doing also some extra work learning with some, for example, our classes de Español, gracias Maria. We are keeping in regular contact with everyone. So our managers are really trying to cope with everyone working remotely and to provide support for everyone wanting to relocate to their home countries in these difficult times. But we're looking forward for the future, so I wanted to hand it over to Keith discussing for the OS later this year.
Thank you. If we can have the next slide. Thank you, Marcello. So finally, colleagues, thank you for bearing with us. One of the big things that we organize every 2 years is a large conference, which is our session. This year, the timing was in October, and we're looking with a theme of livelihoods at risk in a faster world. Next slide. So a big question, of course, comes with every one of these conferences that FAO colleagues have been, trying to organize is, do we go ahead? What is the risk that by October that people will not be able to travel? And should we really be thinking of doing things differently? So just to say, what we have planned is really to have the confidence that we will find a way to go ahead, even if there are difficulties. Currently, the 4-day meeting is structured into 2 days of FMD, 1 day of workshops, which are generic to the drivers of risk, such as animal movements and understanding them, and then 1 day looking at how we would mitigate those risk drivers so that we can, as well as let's say, create faster vaccines. So this is a general theme, but if we go on to the next slide, which is, I think, pretty much the end, you'll all be happy to know. The next one, please. Go on to the next slide. And again, next one. No, next again. That's it. So our question to ourselves is, do we go ahead with a meeting which has got some risk associated with the location in terms of the numbers of people that we would normally need to be there? Do we find a new way to deliver a conference that enables people to get together in ways that they maybe haven't done so much before? We're all getting used to the online environment, but how do we create the face-to-face interactions that you have if you meet people physically? So some of the things we're looking at is whether we can connect e-posters to make sure that the presenter of a poster can be almost instantly connected to the person who's interested to talk to them about their poster. So making it easier to have the poster experience. Virtual meeting rooms, so that we can find a way that we will have breakouts that will enable a workshop type environment, but in a virtual room. Integrating things together. We already have an event app to manage the events that we have, to make it one place on your phone that you can find everything. how far can we really take that in terms of trying to ensure that that links to the more face-to-face things that people want in a meeting, and the idea of having perhaps satellite hubs, perhaps connecting with the virtual learning center idea. Why in this world are we bringing people together when perhaps it might be better if we brought them together more at regional level, but also connecting centrally. So the idea of satellite hubs. So all those things are going ahead, and we've decided we will go ahead with this conference, but we need to try to ensure that people feel comfortable with the option to take either the physical to attend if they feel free and they are enabled to move. The restrictions have been lifted, but anyway, to have the assurance that there will be a conference and they will be able to meet as far as possible by these new ways if we can't meet physically. So I think that closes our presentation. I'll go to the very last slide, and then so we've had this as a symbol for the last year, the lighthouse, really recognizing that waves of epidemic diseases are coming. We often can do little more than be aware that they are coming, of the risks, and help prepare those who are at risk from what might happen next. So I think in this COVID situation, we're kind of trying to look into the future. We know there's going to be challenges, but we hope that some of what you've heard might be relevant to other colleagues to discuss. And I'll finish there and say over for questions and through the chat box or by other routes. And perhaps Felix, you may also want to say something before the close.
No, it's an interesting presentation, Kit. I suggest that you continue, and then maybe only one point that I want to mention about the next meeting on Monday, that we will have it on AMR. We have the Multi-Partner Trust Fund. It was requested during the AGAH cabinet meeting. We want to bring on board PSR again. What was the procedure that they used to establish this multi-partner trust fund, so that maybe other group can learn from the AMR experience. Over to you, Kit. Maybe I am sure that there are maybe several questions. If you can maybe assist monitoring the discussion. Thank you.
Okay, thank you. Well, it's
okay, Keith Barhe speaking.
Hi, Barry.
Yeah, thank you very much, the organizers and you and your team. I found this kind of presentation quite useful, very important, and at this time entertaining as well. I found it also to be being a bit long, that it doesn't give really enough time for interaction, because I know there were fantastic information in it, and many colleagues participated on that. I loved the way you assigned the presenters as well. But I think this could have been really divided into 2 or 3 different presentations, so that we'll have at least the lion's share of the presentation for the participants to entertain. Now that we are reaching at the end, probably if there are any questions, people may rush to go for their lunch and go without putting their questions. So I think for the next, let's be a bit conscious of the time to let the presentations be very precise, and then make it more participatory, that at least half of the time to be provided for questions and answers session. Otherwise, yes, you started by saying activities before and during the COVID-19. I look forward to hear activities post-COVID. That means when we are getting rid of this scenario, and then during peacetime, during missions, and then to report to us what we are doing in the field, moving as we've been doing in the past. My last message is just to wish every staff member, and as Brahanu was saying, the over-increasing number of member states being infected is something that we can say almost 90% or 95% of member states are now infected. From country to country, the level of infection may vary due to COVID, but at the same time, it's a golden opportunity for those who are lately being infected, that they can have best practice from the previously affected countries, so that to take care of their community, their people, and their own, particularly their family. As I was mentioning in the previous message with ECTAD, I was telling my colleagues take care of their own safety before serving the communities and that of their own family. With this, Keith, over to you. Thank you very much for this overwhelming kind of presentation. I wish you all the best.
Thank you, Barry. I know we did take longer than we planned it to be 20 minutes shorter. It didn't work out that way, and maybe these days we don't even have time for the practices we need. But thank you for bearing with us. Now, many of us will be prepared to stay on for another 15 minutes if there are things to ask. We understand if people do need to leave, but the suggestion is everyone turn on your video. Let's see what happens to the broadband availability. But then this way, the hosts will be able to get a picture of everybody who is attending, which would help. Thank you, Charles, for your note. That's also great. I think, wow, that's a great picture. Thank you, Barry. Yeah, some people don't have cameras, but that's so if you need to leave, please don't feel you need to stay here. But if you want to type messages or you want to speak, go ahead. But at least you know some more of the people who are active in our team, who I think will be very happy to give you any guidance if you like.
Sorry, Kid, may I?
Yes, Felix.
Yes, I was wondering, because for each presentation, maybe we need maybe two or three bullet points to take home, or maybe the advice that maybe we can because the message from the Director General requested that we should use this opportunity to have new idea. Barry just mentioned, are we able maybe, my question is to you and Barry, are we able maybe to adopt maybe this methodology that we can maybe suggest to management as maybe awaiting, as Barry was saying, almost 95% of the country they are infected. Therefore, we will have few training, we will have few travel, we will have few meetings, and so on and so forth. Can we maybe try to see whether, to you and Barry, can we maybe try to adopt this thing, this methodology, as maybe intermediate system, maybe to address the need of member country? Over to you.
Do you want to say, Felix, which of the things you've heard you thought was most, applicable and interesting?
For me, it could be it could be the training, distant training, e-learning, and so on and so forth. This maybe these two, because in any case, when I'm looking within AGA, many of us we are doing a lot of capacity building, and capacity building that we have been doing is face to face. But now we'll be facing problem in terms of travel. We'll have limitation in terms of travel. We have to find solution to maybe the current situation. How are we able to address, if maybe they agree that from the director call us back by the end of next week, that okay, we have to come back to the office, but we have 95 countries where we cannot travel to. We have to continue supporting member country. What will be our approach to continue supporting member country? Over to you and Barry, if possible.
Okay, thank you. The point raised. That's. Thank you, Felix.
Please, can I come in, maybe?
Yes, please.
Yeah, thank you very much. And partly it answers Felix's question. The virtual learning center we established in Southern Africa, the time did not allow us really to elaborate much about it, was conceived, was introduced before the lockdown. So basically it is something which during the peacetime, not only wartime, as the director said, is very important for the three things Paolo was mentioning. One is training, the e-learning on different topics, preparedness, strategies to follow, disease control, new methods, etc. But also to facilitate meeting of networks, the animal health networks, like the epidemiology, the laboratory networks, and eventually also to contribute to continuous professional development. In Southern Africa right now, because of the lockdown, we cannot hold any meeting. What we are doing right now is for project implementation, one of the major projects we have with SADC, we are using this tool to bring on board organized meetings, validation meeting, for example, for the strategy for the PPR and foot and mouth disease, the two diseases which are the focus of this project. We would like to bring the 16 countries representative to discuss with them on how to go about the prevention control of these diseases and also move along the progressive pathway. So one of the things we found a challenge, and we are working with EuFMD these days, is the language issue. These online tools we have today are very good. We are communicating in English, all of us, but we need simultaneous translation, for example, into Portuguese and French, working languages of the SADC region. So we are, as we go along it, we discover some challenges. Zoom allowing us 40 minutes, but we probably require more longer period of meeting with more participants. These are some of the challenges posed, and we are looking and getting also solution to some of those things. So this really is not only during the lockdown, but during normal times, it enables us reduce travel, not only for us as FAO staff members, but also for member countries. People will stay at their duty station, working part of their day without affecting much of their day-to-day activity, but receiving or participating in meetings. In short, I would like to just contribute that. Thank you.
Thank you very much, Berhanu. I think that's very good illustration, very good example of the demand and the challenge. I think I saw Holly as well, briefly.
There's also Charles Bebe.
Yeah.
Holly, go ahead. And then Charles.
No, I just typed because I was just saying it's based on what Felix said. It's a good idea to start thinking of this as an approach or strategy. The only caution or thing to be mindful or considerate of is the fact that some of these countries may have problem with internet access, bandwidth, and so on. So it may be easy from here where everybody has sufficient high-speed internet, but caution should be exercised or carefully evaluated, especially if you want to apply it to many countries. Make sure that they are ready from that standpoint, since it's an internet-based approach. Thank you.
Yes, thank you, Holly. We are aware of that, and in fact, we've adapted quite a lot of the training to mobile phone use, which is going to be better or more available. Doesn't solve everywhere, but it does at least mean that most people can have more opportunities. If they can't use their desktop at work, they could use their mobile when they're at home or in another location. Charles, did you want to come in?
Well, a quick one. Thanks. Number one, really congratulations for the excellent presentation and achievements. A quick one is related to the what we are planning to do in Eastern Africa, and you're all aware of the discussion that are ongoing between EuFMD and ECTA Eastern Africa. We would like to build on the experience of Southern Africa, and I think this is a very good example to follow. And Berhanu, despite the distance and the COVID, I think we have a lot to learn from Southern Africa experience. I think that's the way to go. I will just want to add on the issue of the language. I think, again, this is a lesson learned from Southern Africa. I think in thinking forward and how we can expand the experience in East Africa, we may also think about the Swahili, so to have a language like Swahili. You know, Swahili is widely spoken in this region, and I'm sure as we will be working with some local communities, that would be helpful. Over. And once again, congratulations.
Thank you. Yes, we do have actually, we have translated a number of the courses into national languages, which are not FAO languages, from Serbo-Croatian, Estonian, Hungarian, Mongolia. So this is the aim of any of the e-learning we develop is that it should be very easily translatable, not by machine, but by somebody who's, so we've done that, and Swahili I think would be a big group of countries, so that would be a very very attractive one to put on the list. Yeah. Okay.
Yeah, Kees, can I say a word on translation, please?
Yes.
Yeah, Charles, thank you for that feedback. Yesterday we had a testing session with colleagues from EuFMD and the project at SADC in Gaborone. The single language delivery of these learning tools in any language is possible, as Kees was explaining, and many of them has been done. But the issue was to simultaneously having an interpretation, simultaneous in 3 or 4 languages. And lucky enough, Zoom has that facility whereby we were testing yesterday, and it works very well. It's just a matter of really knowing how it works. Otherwise, even meetings, simultaneous interpretation can take place. Over to you, Kees.
Thank you, Berhanu. I was going to mention it, but I wasn't in that test, so I'm glad to hear that test.
We tested yesterday.
Brilliant. Okay, so there seems to be, for so many of our issues, there are potential solutions. We just have to teach ourselves sometimes how to use them, and then to bring them in. And what we've learned in our team is that we have to rededicate people from what they were doing, maybe more on the travel management, towards supporting things in this new way. Anyone else to come in before we close?
Aaron has his hand.
Okay, I missed that one. Iran, go ahead.
Hey, good afternoon. Greetings from sunny Budapest. I'm glad to see that half of FAO is on the Caribbean beach. I see that behind them there's the screen of palms and nice beach. Well, thank you very much. It was, I came late. I got the important part of it, but it was really comprehensive presentation. And here in the Rio, we actually adapted it. I'm not sure if you mentioned it to Danielle and Mark adapted it for e-learning on African swine fever and also on lumpy skin disease. So there are a lot of opportunities in doing so. And we really advocate for e-learning. Also in Mongolia, we pushed for it. But I would like to mention that this capacity building that we are doing, again, we need to ensure that these trainees have the opportunity to implement what they learn. Because naturally, if they don't really go into the hands-on part, they forget about it, or it is just not used. And sometimes, and often we actually train low-level officials, and the high level is not really aware of the importance of this knowledge to be implemented during emergency. So we really need to, I don't have solution right now, but we really need to ensure that somehow this knowledge is implemented when necessary.
Yes, thank you, Eran. That's something we've been a lot concerned about. I mean, one of the things we've looked at, but we really don't have the funds ourselves to do, is to connect the end of a course, when very often the trainees come up with proposals, things they would like to do tomorrow at home in the field. How do we connect them with a source of even very small little bit of finance, a few $1,000s, just to give them the incentive and the tools to go and do it? So I think, you know, we believe that the application side is important, and the other one is building on top of one course to have the requirement for field work and application before you start another one, before you get, let's say, accreditation. So Marcello, who was in the call earlier, is our Chief Learning Officer, and we're looking at how we may ensure the quality is such that we could then make this sort of sequence for individuals, so there would be a learning pathway in which they would have to apply what they're doing if they're going to then prove the that they
if I may add something, I think that another option is when we are going to be involved in projects, not necessarily on FMD, we can involve as part of our activities this e-learning, and then we have the opportunity, because the funding exists, to implement some of this knowledge right away as part of the project.
Yes.
So that looks to me another option.
Yes, I think you heard earlier on the virtual workshop approach, which Fabrizio and Shaheen were talking about, which is quite labor intensive, but it is so we can, I think FAO projects could well consider, can you deliver things in another way? Can they then be supported at a distance to be able to be followed up? So it's a different form of input. Okay, anybody else? I think we should close this by 1:30, wherever you are. Give you a chance.
But
Yeah.
there are two questions.
Sorry,
go ahead.
Yes, I want maybe to ask maybe Eran, Verano, and other colleagues from the central offices. Till today, the presentation is from headquarters. If really you have any best practices that you want to share with everybody, please let us know so that we plan for your presentation. Over.
Will do, Felix. We'll send you email.
Well noted, yeah.
Thank you.
Thank you.
That would be great. Okay. Marcello, I think just you wanted to come in?
Yep, there are two questions about EuFMD learning. So in the interest of time, probably it's not the best moment to answer them very briefly. So if anybody is interested in our hourly learning works, I suggest you to contact myself and Jenny Mood, who was earlier in this call, but she has left. So please contact us offline, and we'll be back to discuss. We'll be glad, sorry, to discuss.
Okay, Barry, we see you there with your. But I think we'll need to close.
Sorry.
Okay. If there are no other comments, I really just wish everyone to stay healthy, well. Do take a break now if you possibly can. Go and at least walk around your room, try and get some form of fresh view on things. We hope we have opened your eyes to some of the things. I know other people are innovating as well. Everyone has to in this circumstance. So the more we can do to share. I like the ideas in this that came up in the chat box, that we would organize something so we can talk about how to better, let's say, assist our colleagues at headquarters who are interested in the approach and how we might integrate things. Thank you, Eran and others, for mentioning how we've been working with you too on the ASF courses and lumpy skin courses. So we're happy to help FAO sub-regions meet their demands on them. So thank you all, and thank you for this opportunity.
Thank you, Kis. Thank you, everyone, and let's keep moving and make it more dynamic, as Felix was mentioning. Let some kind of presentations come from the regional offices so that it will be more participatory. Thank you indeed.
Yeah, thank you, and good day. Bye-bye.
Bye.
Thank you.
Bye.
Bye.